You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. Today we are talking with Michaela Olson, Clinical Program Director of Oncology at Johns Hopkins Hospital and Johns Hopkins Health System in Baltimore, Maryland, about the latest updates in hazardous drug safety. You can also earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks for joining me today, Michaela.
Thanks for having me.
So to start us off, tell us a little bit about your nursing background in hazardous drug safety.
Well, I have been an oncology nurse for 30 years. I have been involved in safe handling pretty much since the beginning of my career as an Army nurse. In the Army, in the area that I worked, there was a lot of emphasis on protecting employees. And so I became interested in the topic and over the years began to write and publish and do my own work in the facilities that I worked in to improve the safe handling of hazardous drugs. So I currently am the lead editor of the chemotherapy and immunotherapy guidelines and recommendations that ONS publishes, and we are working on a second edition of that book right now. And I am second editor of the current safe handling guidelines that is also an ONS publication. And we are getting ready to work on I think it will be a fourth edition of that book. I've been very passionate about this topic. I've traveled around the United States and internationally to other countries such as China and Bulgaria and Japan and many other countries in the Middle East as well to inform nurses and pharmacists and other healthcare providers about the risks of hazardous drugs and to teach safe handling to improve our practices. Because ultimately, we as healthcare providers are spending a lot of our time treating patients with these drugs that are helpful in curing and controlling cancer. But at the same time, we have to remember that our own health is of the utmost importance. And so I've just been really involved from the beginning. I also had a misfortunate event in the late 90s. I had an ectopic pregnancy, and I had been giving a lot of chemotherapy at the time. And that just really hit home to me and also made me more passionate in helping to teach nurses. We have a lot of things that we can use to protect ourselves. And I think just knowledge is really key here.
Thank you. What an amazing history, the work that you have done in safe handling, and knowing some of those nurses who I've seen them come up to you at conferences and things like that. And just thank you for that work and how important it is that we get this kind of information out to nurses. And as there are going to be new nurses coming in continuously and not having experience in oncology, just how important it is for them to understand and know what that safety is about.
Now there's so much more information about hazardous handling. It's an expectation that everyone has that knowledge upon hire and then receives annual training on how to protect themselves. With that new expectation, we not only will ensure that everyone is informed upfront and has that knowledge and has the ability to protect themselves in the environments that they work in. What I've worked very hard to do is to educate our existing nurses that have been doing this for a very long time and may not perceive that they are at risk, just to really help them understand that not only are they at risk, because we know that long-term effects can include genetic mutations and other problems that can affect our health long-term, but that also anyone in the environment that chooses not to follow safe handling precautions puts other employers, other caregivers, and anyone that is in that environment puts them at risk by not following precautions. So we owe it to ourselves and each other to really become knowledgeable about this and take all of the precautions that are available to us.
So, Michaela, you mentioned briefly that you have been involved in a few of the publications that ONS does produce related to safety and chemotherapy administration. Are there other things that you've worked on that have to do with safety and safe handling?
Yes, we also wrote Oncology Nursing Society and HOPA, which is the Pharmacy Association, worked on a joint position statement for hazardous handling, which can be found on the ONS website. And it was really such a wonderful process to go through, joining together with our pharmacy colleagues who feel just as passionate about this as we do and are also potentially exposed as we are. And so that was just a really great process to go through with those colleagues. And I would encourage you to read that position statement. That can be something that you can use to take to your leadership in your institution or your small clinic or your large organization to be able to show them what the ONS and HOPA position is on the safe handling of employees. I was also recently involved in a really great publication looking at surface contamination. We developed some consensus guidelines around surface contamination because we know that we use hopefully everyone is now, it's a standard that we're using our PPE, we're using our closed system transfer devices, but how is that drug being handled every step of the way from the time it gets delivered to the organization, to the chair side and administered to the patient, and then finally disposed of? Do we have breaks in the system where we're contaminating certain places in the environment? And we need to understand that chain of custody of hazardous drug, and we need to know if there's contamination and we need to mitigate that. Those consensus guidelines are also available and can be helpful to change practice in your organization. Lots of great detail in that publication about how you can do that and where you can look for that contamination.
Thank you. Such great resources for our listeners to be able to tap into. So, ONS is in the process of updating some of the content in its chemotherapy, immunotherapy courses. Learners might notice some of the changes in recommendations on doffing personal protective equipment, which we'll call PPE from now on. What do those changes include? And can you talk about why they've been made?
During the COVID pandemic, a lot of people actually looked to oncology nurses for that guidance about wearing PPE and donning and doffing. And we know that that's something that we do frequently to protect ourselves from hazardous drugs. But we also have that similar workflow when we deal with bugs. So, as we were working on the second edition of the Oncology Nursing Society chemotherapy and immunotherapy guidelines and recommendations for practice, we were really looking into the detail of what we were teaching in the course and the information that we had in the guidelines. And we noticed that if you look at the CDC guidelines for doffing PPE, they're very specific because they want to protect the employee from getting any kind of microorganisms on their person, on their body. What we did was we aligned the doffing requirements with the CDC. So whether you're doffing because you were in a COVID positive room or you were doffing because you gave hazardous drug, you're going to do that the same way. And the way that we're recommending that that's done is when you're doffing the PPE, you would first remove the outer gloves and then you would remove the gown. If there are booties in use, then those would be removed. And then you would remove your inner gloves and then you would wash your hands with soap and water don a separate set of clean gloves and then remove the mask and the face shield if it's in use, and then doff those gloves and rewash the hands. And the reason there's an extra step there with donning those clean gloves is that you don't want to remove your PPE and your booties and other things with those inner gloves and then go ahead and reach up to your face and remove your mask and face shield, because you could potentially contaminate your skin with the hazardous drug that could have been on your gown or your booties, etc. So that's just another way to keep us all safe.
When do you think those changes are going to go into practice?
Well, that's a great question. So Oncology Nursing Society has been working on a really fabulous video to help demonstrate these changes, which I think people will really enjoy and use for teaching other nurses. That video, I think, is almost ready. And then we have the guidelines, I'm excited to say, have all been turned into ONS publishing. We in the stage of doing page proofs. And so in a couple months from now, we will probably have those back, and we're looking to have a book by the end of the year, a second edition of the guideline book. And just another plug for the book, we've made a lot of amazing changes to the book. The hazardous drug chapter has been updated, and the book has been updated to be more inclusive of all of the new cancer drugs that have become available in the last few years, and there have been many. And many of them are hazardous. So it's important that we have this information in our guidelines. And then hopefully the safe handling of hazardous drugs ONS book will be updated in 2023.
Great, thank you. ONS receives questions frequently. Some of the most common questions received at ONS is whether nurses who are breastfeeding, pregnant, or trying to conceive can work with hazardous drugs. Can you talk about what the evidence and guidelines are for this?
I am really happy to say that the Oncology Nursing Society is very supportive of our members that are male or female that are trying to conceive or are pregnant or trying to breastfeed. And we want it to be an individual decision by the member or the nurse or the pharmacist or whoever that might be. So there is information about this in our joint position statement and also in the currently published chemotherapy and immunotherapy guidelines. You can find this in there, and the safe handling book. And what we say is that the employee needs to inform the employer, and that the employer should offer alternate duty. Now, we're still working through the detail of this, but a lot of organizations, the way they're handling this is that they're having the employee file through occupational health for an accommodation and work with their OB provider to get documentation and submit it so that they can have an alternate duty. And that's really the right way to do it so that everything is official. But ultimately, it is the choice of the RN.
Thank you. I think it's important for folks to hear that. That is good information to have and to think about, whether it's for yourself or colleagues that you're working with.
Right. And I think that it's important to just be open with your employer and to make sure that you have that conversation and that you know that it is your decision and that you have that choice. It's also important for the employer to be creative and flexible. So in my area, we have nursing triage, we have a central line blood draw room, we have a nurse verification program. So there are areas where a nurse could be cross-trained for a period of time so that they could do some alternate duty and not have to actually administer chemo if that's their choice. So creativity is important. We also have on our heme malignancy side a lot of patients getting blood and platelet transfusions. So that would be maybe an assignment that a nurse could have temporarily working in that area, giving blood and platelet transfusions instead of hazardous drugs.
Another question that we get, are immunotherapy drugs considered hazardous?
I was thinking this when I was updating the guidelines and we were working on the immunotherapy chapter or table, I should say. So the term immunotherapy is pretty inclusive of things like immune modulators, which are thalidomide and lenalidomide, and we know those are very hazardous, especially reproductive hazards. We know that there are drugs in that category like interleukin 2s and interferons. And so it's important to look at the NIOSH list to determine if a drug is hazardous or not. And we are all waiting with bated breath for a new NIOSH list to come out because it isn't all inclusive at this point. So you should, in your organization, have a process in place for reviewing every new drug that is administered in the setting to determine its hazardous potential. A lot of the monoclonal antibodies now that are coming out are actually conjugated with a cytotoxic agent. So again, some are considered hazardous, some are not, and it really gets down to the detail of how that drug is made and whether or not it has known hazardous potential, whether it's an immunotherapy drug that has chemo attached to it, that would obviously definitely be hazardous. So it is very individual for each of the drugs. And I know that was kind of a long answer, but I think it helps us to understand that we really do need NIOSH to come out with this new list, and that's very helpful. But until then, we have to individually assess all of these drugs to know their risk. Our pharmacies should be labeling them as such so that the nurse at the chair side doesn't have to guess whether it's hazardous or not, that it'll be labeled as hazardous and will take the precautions accordingly.
Again, some more important resources and those tricks and tips on how to look for things until something like that new NIOSH list comes out. So we're talking about using hazardous precautions and things like that, but how long should hazardous drug precautions be instituted?
The majority of drugs are considered, once they're completed, out of the system within about 48 hours. But there are a number of drugs that actually take longer to be excreted. And so the hazardous precautions would need to be longer. And in the Safe Handling of Hazardous Drugs book that ONS publishes, we have information in a table that has specific drugs and how long the precautions need to last. If someone is continually on something that's hazardous, then they would need to stay on the precautions during that time. And that's really important now that we have all of these new drugs that patients are going home with, whether it's through an ambulatory pump or they're taking it orally, that we've really got to teach every one of our patients about safe handling in the home.
Since you mentioned safe handling in the home, there are so many treatments, the targeted therapies, and just as new therapies arise and new drugs are available, a lot of them are oral. Is safe handling an issue with this route of drug administration? And what should we be teaching patients and their families about this?
It absolutely is. And what we'd like to advocate for is that the manufacturers of these drugs do a better job of putting all this information on the package insert so that we can really understand the risks. And sometimes it's not known or it's only known in an animal model. So again, we're looking forward to that inclusive NIOSH list. And until then, every single drug needs to be interrogated for its hazard. It may be that it's an antineoplastic high risk hazard, or it's a drug that has reproductive toxicity. But whatever it is, we have to handle the oral targeted drugs as hazardous and make sure that we're teaching our patients how to care for these drugs in the home and make sure that their family members are safe, their animals are safe, their children are safe, and that no one's getting accidental ingestion or exposure to these drugs. If there's any crushing or manipulating, then that is going to require additional conversations so that we don't cause exposure in our nursing med rooms or other areas in the home that would put other people at risk. So I think that the topic of oral targeted therapies and safe handling is really big. And I think in the next edition of the safe handling guidelines, we're going to really work on giving some more detailed guidance around this topic because it's a huge one. And as we know, many of our patients are now on these drugs. And we have so many new molecular targets that have been identified. And I think it's just going to keep growing and growing. Definitely a very important topic.
Absolutely. It's a good way for nurses to be able to, you were talking about advocating for a safe environment and for hazardous drug safety. What advice would you give to a nurse who is interested in advocating for that in the workplace, but they're not really sure where to begin?
I love to meet nurses that are interested in this topic and want to work to advocate for more safe handling. I actually met some people at ONS that were new in their career that have a passion about hazardous handling. And it's just so great because we need, Marty Polovich has been my mentor for 25 years. And I always tell Marty, we need a whole army of nurses that have the same passion as we have to bring this forward and to continue to advocate. So I would start with a lot of the resources that I've mentioned today. And then I would also start by looking at the current practices in your setting. Review the policies, review the education. Is it consistent with the oncology nursing guidelines and the ONS HOPA standard that was written? What I did in my organization when I was newer here and younger in my career, I actually did a gap analysis to determine, are we meeting the standards and where do we need to move to get closer to that? And then I was able to conduct wipe studies that showed our vulnerabilities and where we had contamination. And then I was able to do lots of good education to the staff, terminally clean the environment, and then reinstitute proper workflows to eliminate that contamination. Sometimes it's hard to get people to believe that there's contamination or that there's a risk. There are lots of great ways now to test for that. You can do a qualitative test, which is almost like a pregnancy test where you swab the area and then you use this little cartridge and it tells you whether the drug is positive or negative in that environment. So you can wipe for a small handful of chemotherapy drugs in the environment. That can be quite eye-opening. I remember once going in and wiping a nurse's laptop and finding methotrexate on it. And that was the impetus for us to really teach and get people to be more compliant with safe handling and how they handle these drugs. These drugs are dangerous. And just like we don't want to get COVID or other microbial exposure, we don't want to have exposure to hazardous drugs. There's also qualitative surface monitoring that you can do, which is where you wipe for a larger number of drugs and then you get levels of how much drug is in the environment. So starting with policies, looking at the environment, determining if there's a problem, which I can tell you most of the time there is because no one's perfect and we have a lot of room to grow. These can be the starting points for not only improving safety in your workplace, but starting to become more knowledgeable and known as the expert.
I think this is an area that a lot of nurses really do have a passion about, but just don't know where to start. Thank you for those recommendations. PPE should be provided to healthcare professionals who are handling hazardous drugs. And during the COVID-19 pandemic, recommendations were revised in response to PPE shortages. How should nurses address future PPE supply chain issues?
This is a really important topic. I believe that our supply chain issues, for the most part, related to PPE in the United States are resolved and that we have access to PPE. What I would like to do is tell everyone to go take your hooks and all of that stuff you put up off the walls now, because the reason that we made some modifications to the PPE was because we really were concerned that we wouldn't have any PPE. I remember at one point during the pandemic thinking, oh my goodness, if we don't have a gown and we have to give human carcinogens, what are we going to do? Are we going to have to wear a trash bag? How are we going to protect ourselves? We are not there anymore, thank goodness. And we need to stop putting the same gown back on. The ONS guidelines are very strict about one gown that's disposable, and it's disposed of after its use. And what I am still seeing in practice is I'm seeing a lot of gowns being reused, not only for one patient, but I see practices where the practice says you get one gown for the week and you put your name on it. And that is absolutely not something that we will advocate for, because when you take that gown off and put it back on, you risk contaminating your skin and your clothing and everything. If we have future supply chain issues, then we'll make modifications and we'll have discussions about the safest thing to do. But right now, we're going to focus on what the guidelines say. They are evidence-based, and they are to protect all of our staff who handle hazardous drugs or hazardous drug waste.
Thank you. Well, Michaela, this has been very informative and a great update on what is going on with safe handling. I like to finish all of the podcast with a few questions, and we're going to go through those real quickly now. And the first one is, what are common misconceptions about hazardous drugs that nurses should know about?
I think one of the big misconceptions I hear is that people are only worried about the reproductive toxicities, and they say, I already had my children, so I'm not concerned about that anymore. But there's a lot of emerging evidence showing that some of these drugs can cause chromosomal abnormalities. And some of the chromosomal abnormalities can mimic or can be consistent with those we see in patients with MDS or acute leukemia. We all want to live long, healthy lives and see our children or grandchildren, if we wish to have them, and we should take care of ourselves. And so it is a concern for all of us. And again, I mentioned earlier that all of us have to do that, or we cause surface contamination, and then others in the environment that are trying to be diligent about their PPE are inadvertently exposed. And then the other thing I wanted to say is that a misconception is that all hazardous drugs are chemotherapy, and that's not true either. We talked about some of the monoclonals that can be conjugated with chemo, and people don't think about that. We also know that on the hazardous drug list are a lot of drugs that are given all over hospitals and inpatient and ambulatory settings, like ganciclovir and lots of drugs that can cause reproductive risk. So we are also going to focus on, with the next safe handling book, really the hazards to any nurse in any kind of a medical setting. It's not just in oncology where we give hazardous drugs. And I think oncology nurses are positioned in a perfect place to be able to teach our colleagues that work in other departments about the hazards of drugs.
What's something about hazardous drugs that's not often discussed, but you wish people knew more about?
I kind of put that answer in the prior question a little bit, in terms of people don't discuss all the drugs that are hazardous. And I always encourage people to understand that it's not just in the cancer center or in oncology that we see hazardous drugs. They can be given anywhere in ambulatory or inpatient settings across our hospitals. So just really knowing every single drug we give and whether it's got any kind of hazard, whether it's carcinogenic or reproductive toxicity.
What additional training or education do oncology nurses need to fully understand the impact of hazardous drugs on their health?
Well, the ONS and USP 800 both recommend that everyone that's going to be handling hazardous drugs or hazardous drug waste receives initial and annual training. There should be some didactic and hands-on training program that oncology nurses attend that will increase their comfort with how to don and doff the PPE, what to do if there should be a spill. And it really helps them understand the impact. It helps them be aware and have informed consent, so that when and if they choose to conceive or breastfeed or have other decisions that need to be made, they will be well informed about that and can ask the right questions. Every nurse should have training prior to. And I think this is why I'm a huge advocate of the ONS Chemo and Immunotherapy certificate course, because it has great content in there about hazardous handling that nurses receive, and then they get introduced to the publications where the guidelines live.
And then finally, what are some additional resources for whether we're talking about patients or providers who want to learn more?
I think the ones that I mentioned in the safe handling book, we actually have some information, some nice appendices and guides for patients with safe handling in the home. Lots of good resources in all of the ONS publications that can be used for patients and other providers.
Well, thank you again, Michaela, for joining me. Do you have any final comments today?
I hope that some of you will or already have a passion for advocating for safe handling. It takes a village, and we're moving in the right direction. I look forward to maybe meeting some of you in future ONS conferences and hearing about the great things you've done in your organization or even in your small community practice to improve safety and to advocate for yourself and others.
Thank you. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.